Did you know you can perform the majority of your uterine and pelvic reconstructive surgeries with only a few surgical instruments? This is one of the advantages of vaginal surgery, and once you master their use, you will be able to benefit your patients in a simple and very effective way.
One of the advantages of vaginal surgery is that, contrary to other surgical approaches, with only a few instruments, you will be able to treat a great number of patients, from those with uterine pathologies to those with pelvic organ prolapse and stress urinary incontinence. So these are the instruments that we use all the time. This long-bladed weighted speculum is what I call my third assistant, because once I open the posterior cul-de-sac and place it inside the cavity, it protects the rectum and expands the operative field. The short-bladed weighted speculum is found in the majority of hospitals and is used both before opening the posterior peritoneum and before closing the vaginal cuff, after the surgeon removes the long instrument. The Breisky retractors come in different lengths and widths and are used to retract the bladder and lateral vaginal walls, and also during revision of hemostasis at the end of a vaginal hysterectomy. The surgeon must avoid putting many retractors during vaginal surgery, which has only enough space for doing one thing at a time. The Z-clamp is used for clamping the urosacral, cardinal, ligaments, uterine vessels, and adnexal pedicles. There is the semi-curved Z-clamp and the curved Z-clamp that we use when we are doing an oophorectomy by clamping the infundibulopelvic ligaments. Notice the difference between the Z-clamp and, for instance, a 4-clamp, commonly used in abdominal hysterectomy. Not only is it a stronger and more robust instrument, but also the grooves are deeper and laid out longitudinally. We also use 4 or 5 Leahy clamps, which is something like a short tenaculum with 2 teeth, used for traction of the cervix, flipping the uterus posteriorly, and especially when using one of the techniques of uterine morcellation such as hemisection, myomectomies, and wedge resection. I like to use these Mayo Noble scissors, which at the same time is a strong instrument for cutting the uterine ligaments and is also delicate for tissue dissection because of its sharp tip. These are the only scissors we use, even for cutting sutures. The scalpel we like to use during vaginal hysterectomy is a number 20 scalpel, as opposed to number 22, which is commonly used in laparotomy. We like a smaller scalpel because it avoids inadvertently cutting the lateral vaginal walls during uterine morcellation, especially in a patient with a tight vagina. For the skin incision of the transobturator sling, we like to use a number 15 scalpel, as it doesn't require suturing, only a bandage after the mesh is cut close to the skin. The rest of the instruments include Alice, Kelly clamps, a suction aspirator, and tooth pickups. Regarding the needle holder, we use a straight Mayo Higger needle holder, and we also have a curved one known as the Heaney needle holder. The straight one is the one I prefer, and I like the needle to be mounted tilted forward instead of perpendicular because it greatly facilitates passing the suture inside the vagina. We use a number 1 polygalactic suture for all pedicles and also for closing the vagina, as you will soon see. I also use a 0 plane catgut for closing the vaginal mucosa, such as during anterior and posterior colporrhaphy. These are the right and left helical needles that we use for the transobturator sling. And finally, this is a metallic catheter that we use for completely emptying the bladder as quickly as possible. It has other utilities that we're going to show during the procedure.